Good afternoon. Hi. Welcome, everyone. Lovely to have you here. I'll just let everybody have a minute to join in. I hope you're comfortable. Wonderful. Okay. Welcome to our webinar, My Health Record for Aged Care. This webinar is brought to you by Country To Coast Queensland, your local primary health network. I'd like to acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea and community. We pay our respects to Aboriginal elders past, present and emerging, the cultures, and welcome everybody here today. My name is Katrina Otto. I am the Managing Director of Train RT Medical. I won't read all that bio. What I would really like you all to know today in this session, which is on My Health Record and optimizing digital health to benefit residents and patients in residential aged care facilities. I just would love you to know today, apart from being having worked in healthcare for 30 years and being the My Health Record trainer since it started, I train a range of medical software programs and working practices across Australia. What I really love you to know today is I have lived experience. I cannot believe how relevant my lived experience is to the topic that we're talking about today. This is my beautiful mother, Pamela, who lives in a residential aged care facility. We have literally spent the last 10 days going from the RACF to emergency, to a ward, back to the RACF, back to emergency, back to a ward, and today back to the RACF. I completely understand the importance of having information available at the point of care, and I so appreciate how difficult your jobs are and how unimportant the computer is. So please today, I can see, you've logged in. Please use this time, ask me questions. If you would like to talk, I'll turn the mics on, not a problem. Otherwise, type in any questions. If you're having lunch, you might want to type in your questions instead. But I really want today's session to be very relevant for you and very helpful. I might ask you in the questions, if you don't mind responding, if anybody is already using My Health Record in their RACF, and maybe even what your role is in the facility. So today I have these learning objectives, but I'm happy to answer questions or go anywhere you would like me to. If I promise, if I don't know the answer by now, I know how to find out, and I will get back to you. This session is being, I would like to share the learning objectives for today as well. There's my beautiful mother I was talking about. I would also like to share the learning objectives with you today and ask for anybody to type in if you have anything else you would like me to cover. So I have on today's list to look at the benefits of My Health Record, which I can certainly speak to. Also, the whole legislative framework around it, who can use it, how, the importance of having a policy, the roles of people using My Health Record. So let me know in the chat what your roles are in the RACF, whether you're, a nurse, a doctor, aged care worker, or perhaps other. We'll talk about the process, the registration process, the importance of having a training register, and you're already ticking off training, you're here, which is wonderful. And this will be recorded and sent out to you. I'll also show you how you can access further training. There is so much training available on this topic. But just in case this is a new concept to you all, what is My Health Record? Now, it is important to know it is not a complete medical record. It is a summary, an online summary of a person's key health information. Okay, so if you think about it, what is the key information you would need to know about the person you are caring for? Okay, name, allergies, medication, past history, vaccinations. What do you need to know? The summary. It's personally controlled, which means people choose if they have one. They also choose whether they have information uploaded to it. You choose whether you access it. And it is part of a national system. I always think about this in relation. My sister's also a healthcare worker, and she is currently working in the US. And she is always saying to me, I cannot believe you have a national shared health record that is free. Right? And it is. So the idea is that we have key summary information about our person that we're caring for. We have that information as up to date as possible, and that is able to be accessed by healthcare workers at the point of care. And of course, it is as secure as it possibly can be, and being healthcare information, that's essential, absolutely essential. So let's talk about what you might find on a My Health record. Now, a shared health summary, that's what I was just alluding to before. If you think about, even as a person, you go to see a GP, for example, they would be looking at curating your health summary, which is allergies, medications, past history, vaccinations. But if you see someone for the first time, this is what we need to know. If you go to hospital, this is what we need to know. So that's a shared health summary, curated and uploaded by the GP usually. And of course, hospitals are the ones uploading the discharge summaries, and that is working really well. You know, I always like to say, I don't like to set anybody up to fail. I don't work in a perfect healthcare system, either do you. We know this. We do the best with what we have, right? So it's continually evolving and improving. Discharge summaries has been a real success. And I'll tell you a story about my mum's first discharge summary in a moment. But event summaries might be that situation where perhaps a person went out, they had a fall, they saw another GP, maybe they sutured the wound, maybe they gave them a tetanus vaccination. They might upload an event summary. And then should the person need to go back to you or back to the hospital, then they could see that event. Another aspect that's working really well is prescription and dispense records. Now, this is the one thing, in all these years I've been training My Health record, the one thing that doctors have said to me, if I could just see what they've had dispensed, that would really give me a picture. And oh my goodness, I so understand that after hearing, you know, poor sick people having to tell their stories over and over again. And there is no way in the world my 86-year-old mum could remember the medications. So that information just flows in there from, you know, PBS information just flows in there, dispense information from hospitals, pharmacies, GP have prescribed it, that goes to My Health record. And now we have what's called, we often refer to it in general practice as an active script list. So the pharmacists share that medicines list, and that's a PSML, and then there's an ASL, which is an active script list. You're going to hear a lot of acronyms today. We live in acronym soup, I say. Now, diagnostic imaging, so radiology, pathology, and, you know, really importantly also the goals of care. Now, e-referrals is that context of electronically sharing the referral so the person doesn't have to have it with them. And these last three, this is where you come in. So this is the new exciting news that now there is that residential care transfer, reason and summary, and the medication chart. Now, just before I left it was the middle of the night, my mum's first visit down to hospital, which was last Friday now. Or was it the week before? It's been a big week. That was handed to me by the nurse at the aged care facility. So the goal is that we aren't relying, I mean, I'm sure some people don't have a carer with them, a daughter, or as I call myself in this context, an authorised representative. So that on paper, possibly at the moment, the goal is you won't need to do that. The hospital, you'll upload it and the hospital accesses it electronically. The hospital access the My Health record, and I'll tell you why I know that a little bit later, how I know that. So just so you know, these are all the healthcare provider documents. Then you've got the consumer entered information. Now, this is probably not going to be commonly uploaded by your residents. However, I uploaded my mum's advanced care planning documents and added my emergency contact information. So could be. As I said, the Medicare information, the medication information goes there automatically from Medicare, and also the immunizations and their billing history. So MBS and PBS items. This is really, and their organ donor registration information. This is helpful. MBS information is helpful because you might be saying, when did they last have a colonoscopy? Who else is part of their care? Who else is this person, this resident, seeing for their health? And you maybe need to track them down. And then My Medicare relates to general practice, and you might even see in your RACF, you might even see the visiting GPs registering residents for My Medicare. It kind of says that I'm making a commitment that these are my patients. And I mean, I know the GP who sees mum and the residents in our aged care facility really well, and that's already the case, right? He's the visiting GP, one of a few, but it's just formalizing that agreement, basically, and allowing them to have additional access to additional item numbers and additional services that I guess they can offer that they may not be able to at the moment. So that's My Medicare. Let me know if you've got any questions. So if we have a look at that in a bit of an overview, medication dispense view is what you see in My Health record. We'll have a look at the screenshots. So these are just different displays that show a snapshot. So if you're looking for the medication, you could go to the medicines view. So the idea of this is improve continuity of care. I could just tell you so many stories just from the last, I think it's been 9 days since the first visit to hospital with my mum. She gets out today. I could tell you so many stories of how much we need this and how it would improve the continuity of care. And I have to say, I don't think too many tests were redone that weren't necessary at all, because they didn't have the results, because we were in a hospital, so they had the results. But definitely the streamlining of information and the time spent gathering information, the improved decision support. Oh my goodness. Yes, having access to the correct information, and then of course saving time in an emergency. It's also, you know, I'm a big fan of person-centered care. You know, it's really, I just think people need to be informed and invested in their own care. And I know the context in which you're working, but hopefully that makes sense to everybody. So enhance patient self-management and empowerment, having access to that information about themselves, or even someone like me, their carer, to be able, their family member, to be able to have access to that. When I think about residential aged care settings, I often, you know, I'm sorry if I'm appearing a little bit from a personal perspective, because I am a carer and I am involved a lot in the decision making. So this is a key aspect, I say, about this. You know, it's not just about the resident, it's about, hopefully, and I know a lot of residents don't have people like me, but a lot do, right? A lot do have families, and they're trying to access the information as well in order to assist. So let's have a look at it in terms of a clinical task and then the related My Health Record function. So when it comes to medication reconciliation tasks and prescribing, we would go to the medicines view. Okay, so we're trying to figure out what's being prescribed or dispensed. If we're looking at patient intake or transfer, you need their shared health summary when they come into you. That's absolutely the first thing you'll be wanting to see in relation to their health status, right? Any discharge summaries. The first thing I was asked when I went back to the aged care facility when we were discharged from the hospital, the first thing, as soon as I saw the nurse, and I was talking to the nurse the whole time, obviously, backwards and forwards when Mum was sick, first thing she said to me is, do you have the discharge summary? Everybody wanted that discharge summary. And you know how they got it? I accessed it on Mum's My Health Record on my phone, and I sent it to her. That's not the way this is supposed to work. After today, I'm very much hoping you will all take the next step to then be able to access that yourself. Let me know in the chat if you already do this, especially if you've got any good news stories. I always think you need good news stories, right? I got real stories, that's for sure. So discharge summaries, and what we will have is now this residential aged care transfer overview. All right. Now, as I said before, my hospital scenario, they weren't repeating the same tests unless they were necessary. But in the real world, we often do repeat tests because we don't have. Actually, no, I lie. This was a different scenario, but with Mum, we went to see the geriatrician, and the geriatrician didn't have her latest thyroid function test from the GP who goes to the aged care facility. Okay, so, maybe probably needed to do it again anyway, but we often do tests again because we can't find the results. So that is very a very big benefit of My Health Record, accessing those reports. And as a carer, I can access those test results too. I can access the discharge summaries, as I said, I did. And of course, the advanced care planning documentation, so that in the scenario, like I've just been in for 10 days, do we know what the wishes are? And can we access that document? So how do healthcare providers and consumers utilise My Health Record? So you, in the aged care facilities, access it through your conformance software. Now, let me know in the chat what software you use. Is it, oh, I better not state them. What software, I'm going to type this in. Do you use, let me know. Because if you have conformance software, you can just access My Health Record directly through your software, so you don't have to go external. If you don't have conformance software, you can still access My Health Record through what's called the National Provider Portal. So it's separate, logging on separately. All right. You upload through your conformance software. So for consumers, okay, lovely terms, aren't they? My mum's a consumer. Thank you. ECAS, health metrics. I'll have to look up. I'm not sure off the top of my head. Do you know if it's conformant? I can show you where we will find that out. We'll have a look. Now, thank you for that. Okay, well, that's what we're doing here today. We're going to find out if it's conformant or not, and then we'll take that next step. So let me know if anybody's listening in who actually is already using it. If not, our next step's going to be, number one, see, do you have conformance software? I'm going to take you to where there is the list. As there's quite a few different software used by aged care facilities. If you don't have conformance software or until it's connected, you can use the National Provider Portal. And then I'm also saying this to you all as people, as patients, sometimes yourself. You know, I'm not going to ask you if you have a My Health record, but we all got one. If you didn't opt out, you still have one. I actually do use mine because I like to see my own results and have a say in my healthcare. So you can log in via My Health record, log into My Health record through MyGov. I use the My Health app. So My Health app, and I log in. And when I log in, didn't recognize my face. I might keep still. Don't you love facial recognition? How good is that? And when I log in, I can easily switch between my record and my mother's because I am an authorized representative. Okay, so that's how it works. There's also a Health Direct app and a Health Now app. And yes, you can add information. I have added information. So it's an app. It can be used by you. Yep, install it on your phone or a tablet. You can download documents from it. Yeah, share documents, as I did with the discharge summary. Find and book a health service. So we love our apps, don't we? Now, how will healthcare providers access My Health record? So that's what we were talking about before. That picture is of LeeCare, so not the one you have told me about that you have, but that's just another one that is conforming, and that's sort of a picture of what it looks like when you're accessing the person's My Health record. And there's the national provider view, and here's the register of conformity. Okay, so that is the link to go to. Okay, and that's where we'll find, this is just amazing, this website. That's where you'll find all the information you could possibly need for healthcare providers, for people. Okay, and yeah, programs, training and support. This is all the education. I'm going to come here at the end. I won't go there now. I'll go there at the end. Okay. Now, I'll come back to that. And there is no doubt a aged care module as well. Okay. Now, can you access your patient's My Health record? Who are nurses listening in today? Just give me a yes or a hand up or something if you're a nurse. If you are a nurse registered with AHPRA, you have, yeah, wonderful. Well, you have the big tick. You have standing consent. If you are providing healthcare for your resident, you have standing consent to access their My Health record. So you need a legitimate reason to do so. So I think I've given enough examples of that with my elderly mum this week. Providing care to somebody. And so you are authorized by law. You don't have to seek permission each time. And it is best practices to discuss with the patient if the document contains sensitive information. So training this in general practice, I've always said it is a courtesy to let patients know what you're doing and why. And my background is as a practice manager. You'll get a lot less complaints, I always say, if you tell people what you're doing and why. Now, again, I'm very mindful of your situation. You know best, but know that you're providing healthcare for them. You have authorization to access. Now, if they had set it up with security controls, which personally I have on my Health record, they might get an alert to say it's been accessed. Be like, oh yeah, okay, that was the aged care facility. Okay, so you're not allowed to upload if the patient says they don't want it to be uploaded. And if this is more general practice, you wouldn't be uploading a shared health summary yourself, creating one yourself. But yeah, that it is something that GPs should have a conversation with patients, because we don't want anybody to get a shock about what's on their shared health summary. And sometimes that's just a really good conversation to have. Does that need to go on my shared health summary? Well, actually, yeah, other healthcare providers would need to know that about you, because, it's good conversation. So, and then if it's particularly sensitive information, it's not going to be that aspect for you, because you're not uploading shared health summaries, but just so you know, that's how it works. Now, I talked about that privacy and access control settings, so patients can choose to restrict access. Now, I have to tell you, in all these years that I've been training my health record, my opinion, it's just my opinion, take it or leave it, my opinion is, if people really don't want to share things, they just don't have a my health record at all. There is very little evidence of anybody going, I'll have this on there, but not this on there, but I don't, and I want you to take that document off there. Usually if they're worried, they take it. They just don't want a my health record at all. I do recommend setting access controls, absolutely, if anybody is ever worried about it. And as you heard, as somebody working in healthcare myself, I set mine with a PIN number. So if anybody accesses it for the first time, I get an alert. And you heard that if you are providing healthcare for somebody, you have authority. You don't have authority if you're not. And there are serious consequences for deliberate misuse, as there should be with our sensitive healthcare information, as there are with, bouts of privacy. So know that people can set an access code as well. So LDAC, it's called. And that way they have to give you the code in order for you to access it. And you can put that on a document or the whole My Health record. I did not go down that path because I thought, I'm not going to remember what that is. Okay. There are circumstances where if somebody does restrict access to the whole record with a record access code, and some people did that accidentally when they set it up, then they have to give you that code. There is a break glass facility with that. And apparently, I remember back in the Townsville floods, seems like we've had so many floods since then, right? But Townsville floods were so bad, and it saved somebody's life being able to break that glass and access important information because they were unconscious. People can choose to remove documents at any time, and my argument's always been, why would they remove it if they knew what was on it, what was getting uploaded, and had agreed? So again, we're back to that. It's important to have the conversation, and we're back to that's probably not your context. But just as patients yourself, I think it's good to know this stuff. This is the one I have. I get an SMS alert when it's accessed by a new organization. And then know that every instance of access is monitored and logged. And I have to tell you my story about this. It wasn't that long ago, probably about 9 months ago. And all of a sudden, I got a message on my phone to say, your My Health record has been accessed. And I was like, what? I haven't been to see my GP in like 18 months. Like, why would anybody be accessing my Health record? I am well. I was like, oh no, it's been a breach. So I looked into it, and the question I was asked was, do you have a person in an aged care facility? And I was like, I do, my mum. And they said, it was a nurse doing a medication review for your mum. And I was like, I changed really quickly from, this is terrible, to, oh my goodness, how good is that? This is what My Health record was supposed to do. Make it easier. I mean, it's not ideal that she was doing detective work to try and figure out what had been prescribed and dispensed. But having that information all going to the one place so that you can do that, I thought, this is what My Health record was designed for. So it's a good thing. Now, know that this whole thing was built with very strict legislation that controls who can access the system and the information contained within. So obviously it is, people's most sensitive information. Even, think about a discharge summary, like sensitive information. It's got to be so protected, and it is. And these are the relevant acts and instruments, regulations, rules, legislation that protect it. And I've put the links in here because I'm going to send you this and you can click on them and read it. Now, My Health Record Security. So they have a cyber security department at the Australian Digital Health Agency that is monitoring this. And as I said, significant penalties for deliberate misuse, as there are in your healthcare settings as well. Like we all know, FaceTime. That would be my mother in hospital FaceTiming me. She can still use a phone. She's okay. She's just waiting for patient transfer. Now, nothing like bringing the living experience, is there? So all data within the My Health Record system is stored securely, and any of your software goes through strict conformance testing before they're allowed to connect. So that's what your software has to, because if you find that your software is, and we'll have a look, if you find that your software is not yet connected, I strongly recommend you telling them this is something that you want. Okay. Emergency access, we talked about, can only be used if you believe there's a serious threat to life. I kind of look at this quite differently with residential aged care facility, only because I don't think a lot of people will restrict use. They want their information to be available to the people who need it, but I could be wrong. And there's a little bit about the penalties for misuse. And examples of inappropriate use are to check whether any restricted documents exist. This one is a little challenging because I imagine some people do forget the access code, and I'm not saying it's right, but I did have a doctor once who said, that the patient couldn't remember it and he needed to find something, and he said, can I access it? And they said yes, and they got a call to say your My Health Record has been accessed. So the protection and the system does work. So what do healthcare organisations need to do? Register and set up access, confirm the process. So for My Health Record for staff, so this is now, I guess, where you are all at, going, not yet connected, what's your process going to be for staff? And I have to say, it's not in the area that you are at my aged care facility, but I'm going to be going back in there and saying, please, can you connect so that I am not the one needing to give you the discharge summary? You would have had that information the minute she was back, before she was back, on the way, as soon as they'd done it. So ensure there is security and access policy in place, and that staff are trained so that they know how it works, they know the restrictions, they're familiar with the policies, and our ongoing participation and obligations. I should put my mum and I in there. So I am an example, living example of an authorised representative. Makes my sister laugh when I say I'm an authorised representative. She goes, you're a daughter. Responsible for managing, and I have to say, the last week has shown me there's so many people like me, right? Caring for our older people and communicating with you wonderful people. So I am responsible for helping my mum manage her My Health Record because she can't do it herself. A person who has responsibility, legal authority, otherwise appropriate. I did also always have authorized access for my own children. I don't know why any parent wouldn't have my health record for their kids on their phone. I could just bring up that key information, like vaccinations, just like that, medications, allergies, show other healthcare providers if they weren't connected. My kids are old now, they got their own, they're older. And then this is typically what you will have: parent, carer, family member, legal guardian. And then we, as you see, I have complete control over it as I do my own, to access information. And nowhere is this more relevant and more important than the situation you're in. Okay, so nominated representatives, we help access that health information for people when they can't. And again, a person can give levels of control. So I remember one of my sons, as he got older, we changed the level of access. And then it was like no access, no mothers involved. So the clinical audience setting is you, and I really don't think I need to go through Kayla's healthcare journey, do I? I think we've done a real story with my own mother, going from, you to the doctor, the GP was involved with my mum's care, the after hours doctors were involved. At one stage, we had both an on-site after hour doctor and a telehealth doctor online. That's how much was going on with should she go back to hospital or not? I was there, it was in the middle of the night. So this is where you just want that information to be available, right? So going to hospital now, that'll be your transfer document. What they will see is a medicines view, a medicines preview. You'll also be able to see this vaccination view, consolidated view, preview. When did they last have their COVID? Where are they up to? If they had their flu vax, etc. Pathology reports. Okay, so that's what they look like. You can set filters and go, I don't want to see it for the last 10 years. I just want to see for the last 2 months. And the all-important discharge summary. The discharge summary for my mum was first one, was really good. If I had a look now, I'll probably be able to see today's too. It was really good. So that's just going to depend on the hospital and the doctors and them doing it. But how good is that to be able to access on your phone immediately? Now, you won't have to do it on your phone. You'll be able to do it through your conformance software. Okay. But none of this, when I sent a copy to the nurse at the aged care facility, she said, I'm still waiting on the hospital to get back to me to fax it. That's what we're trying to help with. Advanced care plans and goals of care. Okay. Shared health summary we've talked about. That's the GP shared health summary. That's the bit at the moment that the aged care facility, they printed out for me to send with us to the hospital. An event summary we've talked about, and there's a picture for you all of what the aged care transfer summary looks like. So this is new for you. Okay, so the transfer reason, the medication chart, health summary. As I said, the nurse, at the moment, you're probably doing that too. She printed it all out and sent it. And that's what they were all looking at the hospital. So being able to have instant access to this. Now, please type in there any questions that you might have. I talked a little bit about these free training modules. Let's go there. For healthcare providers. Seems pretty intuitive, doesn't it? So maybe if you are, if it's part of your responsibility, maybe start here. You have what's called, I told you there's going to be acronyms too. So when you register for your organization, you have what's called a Health Identifier Provider Organization Number. Call it HIPPO. HIPO. Health Identifier Provider Organization. You all, as healthcare workers, have a healthcare identifier provider individual, a HIPPY. So there's a hippo and a hippie. Oh, excellent. Is that a question? Oh, okay, you're responding to what I said before. Okay, thank you. A little hand up. But please type in the chat or in the questions if you have any questions. I hope I haven't missed any. So you're all hippies if you are nurses, registered with AHPRA or doctors. You are attached to a hippo, which is your aged care facility. That, and if you don't know your HOPPI, get that from AHPRA, and that goes in your software at your organisation. So that's how it all starts. Every person, don't have to worry about them because every Australian has an individual identifier. That's called an IHI, Individual Health Identifier. We were given them about 8 years ago because Medicare numbers are not unique. So the first step, if you're not already, is to register your organisation. And there's a whole little course to show that. Then there is developing your security and access policy. So who in your organisation is allowed to access? What are the scenarios? You need a training register so that you can make sure that all new staff are trained and they understand the policy. Who's allowed to access? Why? How is that used in your organisation? And of course, understanding security, privacy. There's a whole lot of introduction. So these are really good. Self-enrollment, just make it part of your orientation. This website's very good. And then I'll just go back to my PowerPoint for a second. There is a fact sheet. So this is also very good. A fact sheet which is from the Australian Digital Health Agency. So that'll take that picture of how it allows you, what the purpose is, allowing you access to timely and current health information. Now, we say current health information, it's only as current as the people who are updating it. So I'm always nagging the GPs to upload a health summary because, as you know, for your people, their medication information changes constantly. So for a lot of people. So that's why having that information flowing in, the prescription and dispense information also flowing in is just gold, because it's like, that's actually what's being dispensed. We don't know what people swallow, but that gives you that picture. All right. So, know that all of this is available to you. Examples, there's tons of case studies and examples. And the primary health, your Country to Coast primary health network team are relevant. So if I've got a question, if transferring resident to hospital, how do we input information for the transfer? So depending on what software you use and depending on what stage they're up to, I'm just going to go back to a picture. So what happens is, do we have a picture of how to? Because all the software is different. Yeah, there's a picture. Because all the software is different, on that Australian Digital Health Agency website, there would be a pathway to go to your software, and then you would get the specific instructions. And there would probably be a video, and there would also be a cheat sheet, because I know when I was training for the Australian Digital Health Agency, that was what I did. I actually think I created this. So in a varying form, depending on your software. Mary, what software do you use? Can you type in what software you use in your aged care facility? As an example, this software is Medical Director. See, there's a button called Create Clinical Document. So that is how it would be created. All right. So, and when you create that document, that's when you get the ability to type in all those details that you talked about, such as the reason, etc., and attach things like the shared health summary and medication information. So as you can see, that's what a shared health summary looks like. allergies, medications, past history, and down the bottom of that is immunizations. All right. These advanced healthcare directory, they look a little bit similar, these documents. They're called, this is probably technical, you don't really need to know, but they're called CDA documents, which stands for Clinical Document Architecture, which means they all have a similar look like this. And it's good. I get feedback. People go, I know where to look to find the information. The other benefit is, information is dispensed, and then that's coded information that is able to be populated in various places. That's the beautiful thing about that atomized data, right? Rather than our free text typing or writing. So you get used to these and you get to learn, where do I look? As I mentioned before, the challenge I find is, when was this last updated? Still relies on people, right? Still relies on us updating it. And oh my goodness, how many stories I could tell you about the misinformation that I heard in the last 10 days, when the story was all verbal from the patient. It's just too hard. It's too hard for our older people to expect to remember this stuff. So yeah, I'll be really so happy when all the RACFs are on board. And for you, it'll be about, you're transferring your person to hospital. You'll upload this document, and then rather than printing it all out for me, you can print it out as well. In the interim, we kind of do that. When things are new, we kind of print it out as well, just until it starts to become embedded in our normal, right? But at the moment, the first step is to get connected. Or maybe the first step is to learn more, do some more reading, find out your software, find out the conformity status. I'll find that list for you. And then I'll send you that list, and also start to talk to your management teams about, where are we up to with registration? Reach out. You have help available. You have so much help available. Everybody wants aged care facilities connected because hospitals already are, GPs already are, pathology, radiology, dispense already working. We need aged care, right? And so important part of the patient's journey, really. And better connected care. So access this information. This is going to be emailed out to you. Access this information. Reach out to either the Digital Health Agency or your PHN. There you go. That's your PHN's information, and the Primary Health Network team are there to connect the whole community. So they're experts at all this. Reach out and they will help you with whatever stage you are up to. I will also help you. I am here for you. I'm just checking I didn't. Okay. I'm just checking I didn't miss any questions. So please know I am also here to help you. That's my contact details. And as you heard, I have a vested interest in this. I am going to stop the recording now, and then I thought I'll stay on for a little bit and I'll have a bit of a chat with you if you would like that, answer any other questions. But I just wanted to say, I so appreciate the wonderful work that you all do. As you heard, I have from this week probably a little bit too much lived experience in this area, and I see what you do and how much you care and how important you are. So I wanted to thank you and let you know if there's anything we can do to help you get connected as well, please reach out.